And welcome back to the Morning Drill. Well, February, not only Valentine's Day, but also National Heart Month. And from Titusville Area Hospital, we welcome Angie Russell. Good morning. How are you?
Good morning. I'm fine. How about you?
Wonderful. Thank you for joining us. Angie, what's your official title at the hospital?
I'm the coordinator of cardiac rehab at the hospital.
Let's discuss this issue. This is a pretty serious issue. Heart disease is, I believe, the leading cause of death, is it not, for men and women?
Yes.
It's also something that's preventable and controllable, I think.
It sure is.
It sure is.
Yes. That's part of our job that we do at cardiac rehab. We try to educate people on how they can prevent any more problems with heart disease. They've already, once we get them, they've already gone through a heart attack or a bypass or stents or something like that. But then we also try to give them a new lease on life, really. Teach them how to exercise, how to eat properly, how to prevent any more problems.
How much time is dedicated to the prevention part of it?
Oh, we meet 3 days a week. They come and exercise, and every day we talk about education, how to prevent it, what to do, how to live life a little better. So most of, pretty much every day, all the time, we talk about that.
What would you say to somebody who maybe has that in the back of their mind? Maybe they've had a family member who has had a heart attack or has had heart issues. What are some of the top, maybe even the top 3 pieces of information you would give to somebody?
The biggest thing, if you have a family history, and we tell our patients that their kids should be checked. If any family history, go get your cholesterol checked. In fact, the Heart Association recommends having your cholesterol checked in your 20s. And most of us go through life, if you're healthy, some people don't always get checked up, go to a doctor, get blood work or anything, and until they have a problem, they hit maybe age 50 and have a heart attack, and that's the first cholesterol they've had checked.
Wow.
And here all their life they've had high cholesterol, maybe high blood pressure too. But that's a big thing. Go to your doctor, have blood work. If you don't have a doctor, go to the hospital offers like health screenings. They have a spring health fair, like in Tinesta. They offer things like that at a reasonable price.
Do you think folks in their 20s have the mindset that, hey, I'm still 20, I don't have to worry about this for 10, 20 more years?
Yep, exactly. They eat what they want. They do what they want. They don't exercise.
Uh-oh.
We all live life recklessly at times, but really, the people that are aware of that, I think the more education, the more aware that they are. They should exercise, watch what they eat. The healthier people are going to be.
What happens when maybe a red flag goes up? Let's say somebody in their late 20s or early 30s heads up to the hospital to get a cholesterol check, and maybe there's a few warning signs of, hey, you got to start watching. How serious, is that once they get a red flag?
Well, right there is where they should start. Say they have high cholesterol or they have high blood pressure. Start watching their diet. Most likely lose some weight. Start to exercise. Try to take care of themselves. But a lot of people don't. So it's very scary. So the more we can educate people on that, the better.
You said part of what you do is not only the prevention, but the controlling. Let's say somebody's already gone through a heart issue, so now it's the rehabilitation. What sort of life, or let's start with the rehabilitation part. What sort of classes or training do they have to start going through to better themselves?
They'll come to us. The doctor will, after say they have their heart attack, they end up at another hospital somewhere else, have a stent. The doctor will refer them to us. Their insurance will pay for it. They'll pay for, usually it goes by Medicare guidelines. Even if you have Blue Cross, it's all pretty much the same guidelines. And they'll pay for 12 weeks. So they'll come 3 days a week, and they'll exercise. We'll give them that education. They exercise for like 48 minutes. And we see a variety of people. Some can't get off the couch. They're just tired. They've never exercised. They feel terrible. Where you might get the guy just out walking a mile or 2 a day. So we make it fit them and get them started. And once they finish our program, we have them, they know how to check their pulse. They know what their heart rate should be when they're exercising. They know what they should do. They know how many times a week they should be out exercising. So some stay with us in our Phase 3 program. Some may go to the Y. Some buy treadmills, bikes, and have them at home. This time of the year is kind of tough with the bad weather. Summertime, it's easy to tell people, go out and go for a walk. Go for a half-hour walk each day. So I was just telling them that this morning. You should, try and get out in the nicer weather if possible.
It sounds like the point being, don't just sit around, do something.
Yep, that's the worst thing.
There's a time, and I don't know if it's Titusville Middle School and Tim McCord bringing the P for Life fitness program here, but I think there was this mindset that everybody was the same and you had to break a sweat to be working out. But with this P for Life concept, it's everybody is an individual. Working out for the individual's different. So what might be good for me, it might not be good for somebody who's been sitting on a couch for 12 years, or to that
right.
athlete. So everybody's different.
You have to individualize it. And some people are on medication that lowers their heart rate, so you have to figure that out. Tell them what their heart rate should be with that medicine. As an example, just a beta blocker. If you're on like metoprolol or low pressor, then your heart rate should only be 20 to 30 beats above your resting heart rate of when you're sitting still. Whereas for, like you or I that maybe not on medicine, and you can do the 220 minus your age and a percentage of that to figure out what your heart rate should be. And you might be 140 when you're exercising. But everybody's different, so you just have to look at them individually. And plus, you might see somebody that, hey, the lady might be 90 years old, and she looks 50. So you have to look at that too. You look at people and you don't even see age anymore because it's how active they are, how fit they are. It's amazing. I've seen some really good 80-year-olds.
And now the opposite, I'm 17 and I look like I'm 69, so I might have some issues there. I better watch what I eat.
Okay, we'll have to talk.
What do you find? Is it encouragement to folks to keep them living a healthy lifestyle? I mean, it's so easy. We talk about this all. We have 18 kids, or three kids, my wife and I. So we go to the store and we're going through, and you're thinking, okay, snacks for lunch, or a good snack for after dinner, and you see all this junk food.
Yep.
And it's so much easier to get that than it is, and cheaper than it is to,
try healthy.
Yeah, to pick up oranges and apples. And
you have to work at it. It's not easy. I have a 7-year-old daughter, and trying to teach her the right things too. And my husband too.
Well, we're coming off the Super Bowl and all the candy out there for Valentine's Day,
Christmas, all the cookie. Yeah, but you just keep working at it. You try to teach portion sizes. Not to overeat, because you go out to a restaurant and what you get on your plate could feed 2 people. So you try to start there. Watch how much you eat. Watch what you're eating. You order a steak, cut the fat off. You have chicken, don't eat the skin. Don't eat the skin on the turkey. Chicken wings, that's a whole other issue. They don't exist. Donuts should not exist. But it's hard. You're right. I mean, there is so much fast food with our fast lives. It's so easy to go stop at McDonald's or Burger King. But you can eat healthy there. There's the chicken salad. There's a chicken wrap. There's better things at McDonald's than getting the Angus burger or the Big Mac. Yeah. And we teach our people that too. We show them how much fat is in some of the food that they would get at a fast food restaurant.
I think the other thing people forget, and maybe they just haven't experienced it, but the healthier you are, the better you feel, and I think probably the more you stay away from stuff like that, because you just feel you have more energy. You do. And getting back to exercise, people have so much more energy when they exercise. So many people will say, I'm just too tired to exercise. But if you just make that part of your day, schedule it into your day, you will feel so much better. Most of our patients will say, 2 weeks after coming, 3 days a week, 2 weeks to a month, they'll say, I feel so much better. I have so much more exercise. And it's a great job for me because I see people get better and feel better. So it's a rewarding job to see that, because if they stick with it, they're going to feel so much better. And also watching what they eat. Going back to your role at the hospital, what sort of communications do you have with doctors and patients and other folks? I mean, what's a typical day for you? And I'm sure there's no such thing as a typical day, but
well, we start early. We our first class starts at 6:30, so we have people who may exercise and then go to work. And then we have classes, one right after the other all day. 6:30, 7:30, 8:30 a group comes, 9:30, 10:45, and 1 o'clock. So that's, and it's one class right after another. We'll have student nurses come down and they'll say, geez, there's so many people here. We might see 30, 35 people a day.
Wow.
And they all come in, we check their blood pressure, put them on the monitor, watch their heart rate. If there's a problem, depending, they can go to the ER if it's bad enough. We can call their doctor. What's nice about our hospital, it's a small hospital, the doctors are in and out, they're in their offices, we can reach them if needed, and our doctors are very good about responding to any problems. Same with the doctors at St. Vincent's and Hammett. I have to give them a lot of credit too. They refer a lot of patients to us. We have a problem, we just fax things to their office, we call their office, and they get right back to us. So we work very closely with the doctors. We do have Dr. Dunn with us, who has had a practice here in town for many, many years, and he retired from that, and he's at the hospital now, and he's with us in the morning. If needed, he's right there. And
wow.
He walks around, meets all the patients, and they feel good having him there too. Along with myself and Joyce and Pat, we're all registered nurses. We've all worked in ICU or the ER over the years and have a big cardiac history of taking care of people. So if there's a problem, we're worriers. We're on top of it if there's a problem. But people feel comfortable. They come in, they exercise, and they've gone through a big event. They've had a heart attack, and they're just scared. They're afraid to move. They're afraid to do anything, and we get them moving and prove to them that they can live again. They don't have to sit in a chair. They don't have to sit in bed.
I would guess that would be probably at the top of everybody's mind who experienced a heart attack is it safe for me to exercise, or am I allowed to go out and do this again? Obviously everybody's different.
Yeah, but they do worry. And I would too. That's a big event in someone's life, and they're on all new medicine. They're told they have to exercise. They are on a diet now. Their whole world's just been changed. So we try to make it not so bad. They come in, they exercise. We try to make it fun. There's TVs, there's music. We all talk. We tell stories. The patients share their own stories. It's like a big family, and people enjoy it.
And going back to the earlier discussion here, if people start the process now, there's a good chance they're not going to have to worry about that down the road.
Yep. And some people they've been perfect. They've exercised their life. They've watched what they've eaten, and they, come to a point, and maybe they do have a blockage or something, and they'll say, but I did everything right. I thought I did everything right. They might have had some family history that got in there too, but the fact that they took care of themselves made this not such a bad event. They recovered quicker, so it's always good to take care of yourself, and it helps in the end.
For those watching and hearing this, seeing this, what are some warning signs if people start experiencing something they should call 911?
Well, you always hear chest pain. There's a great video that I think it's going to be on this your site about the lady having the heart attack. It's from the American Heart Association. It goes through all the symptoms. She has chest pain, and many times they'll show the man, with crushing chest pain and just fall to the floor. Well, it's not always that easy. Sometimes it's more subtle, especially with women. They can have jaw pain. They could have heartburn. They could have back pain, mid-back pain. You could have arm pain, jaw pain. I took care of a guy one time. He had tooth pain. He went to the dentist repeatedly, and here it was his heart.
Wow. So
you can have very strange pains that you just can't pin down what it is, but any symptoms like that, any chest pressure, doesn't have to be pain. It can be a dull ache. It could be like heartburn. Go get checked out. Sweating, while you're having this pain, feeling nauseated. All these symptoms usually come on together with a heart attack. Not always a heart attack. Sometimes it could just be a blocked vessel, which they would call angina or angina. Sometimes you have those warnings, like you might be walking and you might get a little dull pain in your chest, and then you sit down and it goes away. Still, go get checked out. Go see your doctor. Go to the emergency room. All those things need to be checked out.
And people in their 20s have had heart attacks. It doesn't matter what age,
Yep.
if they're experiencing any of these symptoms, they should call immediately.
Right, and I think we're seeing younger people too, just because of how our diet has gone. More fat in the diet, more overweight people. So younger people are having heart disease.
Wow.
It's too bad, but they used to say, well, they still say, but heart disease starts for women at age 55. Men, it's in their 40s, like 45. But we're seeing them younger.
That's incredible.
So yeah, it's scary.
First thing, folks should call their doctor and get in and just say, hey,
I'm having these symptoms, just don't quite feel well. And
or even if they're not, just to say, hey, I'm...
Right, and people should go get a checkup each year. Yeah, get their blood pressure checked.
Okay.
Easy test to have, even a little blood work, just to see what your cholesterol is. Check on your blood sugar, see what that is. So these are just easy, healthy tips.
Again, February is American Heart Month, and have we missed anything? You brought some information.
Well, we've kind of talked about everything. I was going to talk about risk factors, but we've kind of covered them. Family history is a big one. Things that you can't control.
You have to go outside for that.
I'll get to that. Excuse me. But family history, that's a big one. And your age. Sometimes we just get older and it happens. Things you can control with heart disease. If you're a diabetic, take your medicine, exercise, watch your diet. That helps keep your blood sugar down, keeps things under control. Being a diabetic can damage the vessels, the lining of the vessels. That's what makes them a little more prone to heart disease, as well as smoking. That damages the lining of the vessels. All you hear with smoking is it's bad on your lungs. It is, but it wrecks your vessels. The fat will build up in the vessels, causes rough areas in there. The fat builds up in there, so definitely don't smoke. Blood pressure, high blood pressure, take your medicine. Exercise brings down the blood pressure too, so that's a good thing. Watch your salt, watch what you're eating, watch your diet, cut out the fat. All things that are controllable. Stress, that's another one. People live a very fast-paced life. A lot of stress can lead to heart disease too.
Wow.
Yep.
Do you recommend that people just stop immediately and switch over, or is it best to kind of ease into a healthier lifestyle?
It's usually better to do things slowly, because we'll have people come and they've, say they're in their 50s and they're just used to, say they're smoking, they're eating whatever they want, they're just used to not exercising, just going through their daily life. It's better to do it slowly, because if you quit smoking, you take away all their food. They're eating salads. They have all this medicine they're taking. They're suddenly they have to exercise now. They're miserable. They're just like, I can't do all this. So if you do things a little bit at a time, plus they're trying to lose weight, another one. If you do everything a little bit at a time, it sticks. It usually is better to make it a life habit then.
Very good. Well, I'll tell you what, with Valentine's Day here and people going out and dining tonight, watch what you eat.
That's right. Watch the amount. You can have that steak, but cut the fat off. Just don't have such a big one. Have a smaller steak. It should be the size of a deck of playing cards.
Really?
Yes. Or the palm of your hand. Now, my hand's pretty small, but so just picture a deck of playing cards. And that thickness also.
Huh.
And most steaks are probably 3 times that size.
Yeah, there's...
And your plate should have more vegetables on it than anything else. So
that's a tough one.
Good thing to keep. It is.
I'm a fruit guy. Fruit. Give me as much fruit as.
Fruit is easy. When they say to try to get 5 fruits and vegetables a day, strive for 5. That's tough. Fruit I think is easier. Vegetables you have to work at it. I always tell my patients I don't have vegetables for breakfast, but for lunch I always make myself have a vegetable. Supper always vegetables. So that helps. And then, if you have more than a serving, if you have like 2 servings of vegetables there, that adds up too. So,
wow.
But fruit is much easier. You can have fruit for breakfast, mid-morning snack, afternoon snack. It's just easier. But it's healthy. You gotta have all those healthy foods.
Excellent. Again, February, American Heart Month. Angie Russell joining us. Angie, if anybody has questions, they would like more information or to get a hold of you, how can they reach you?
Just call the hospital switchboard. Do you want me to give the number?
Sure.
827-1851, and just ask for cardiac rehab. We're always there.
And thank goodness you guys are.
That's what I always tell people. Just give us a call if you have any questions about anything.
All right. Again, February, American Heart Month. Angie, thank you so much for your time.
Thank you for having me.
All righty. The Morning Drill will be right back right after this.
Well, I will never make her sad. I got a heart.